Coming in hot.
Yeah.
Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody, and welcome back to another episode of Hello Health. My name is Kyle DeVries from Health Benefits Associates, and I'm going to be your host today. Now, today we have Sedona Shonnard, a physical therapist from Northern Nevada Medical Group, on the show talking about balance and fall prevention. But before we get into that, I want to give you a little bit of a background on who we are and what we're doing here. Here at Health Benefits Associates on our YouTube channel, we like to post a lot of videos here about multiple topics on healthcare to keep you updated on the latest news. We have a lot of pre-recorded videos from Medicare to group health to individual, as well as a lot of live presentations that we do here on our channel. One of those live presentations that we're going to be doing is coming up in September. It's called Mastering Medicare. Our local experts here, Alex and Matt, are going to be going over various topics of Medicare just in time for the annual enrollment period. They're also going to be opening it up to a Q&A session. That way you can ask your questions and get them answered live on air and get you ready for the annual enrollment period. Now, what is Hello Health? Hello Health is a show that we've been doing the past couple of weeks where we've had doctors from the area around here talking to you about various topics. We've had Dr. Wright from Western Surgical talking about parathyroid disease, to Dr. Letitia Anderson from Northern Nevada talking about good blood pressure. They've been great presentations, and today is going to be no exception. Now, if you like the content today, make sure to like and subscribe to our channel and ring that little bell notification in the corner. That way you're notified when we go live, and that way going over these next couple of weeks, you'll see those live presentations pop up. Now, before we get over to Sedona's presentation, I'm going to go ahead and give a little bit of a background on her. In 2019, she graduated from Western University of Health Sciences with her doctorate in physical therapy. She was one of 2 people in her class to receive the Clinical Excellence Award, which means she performed the best during her clinicals over the time she was in them. Now, ever since, she's been working over at Northern Nevada Medical Group, at their physical therapy office down on Steamboat Parkway, as well as she splits time for inpatient and acute rehab over at the Sparks Hospital. Now, without further ado, I'm going to bring Sedona on here, and we're going to have her present her topic of balance and fall prevention. Sedona, can you hear me?
I sure can.
Awesome, take it away.
All right. So, like you gratefully said, I'm looking into balance and fall prevention today. So I'm going to start by discussing a little bit about balance. So our balance system is composed of 3 different systems in our body. The first one is called the somatosensory system, and this system is pretty much how our bodies identify where we are in space or our sensation. I think of it kind of like the difference between walking on a level ground or walking on a sandy beach, right? You definitely identify the difference between the 2, and that's our somatosensory system. The second system is our visual system, our eyes, right? Our eyes are able to give us identification of where things are and how we can respond to them. And last is our vestibular system, and our vestibular system is made up of different canals and crystals, actually, and it kind of looks like this. This would be in my right ear. And as we move, it responds to gravity and velocity, and some of these crystals, you can kind of see these guys moving, go through our system, our canals, and tell us when my head is moving in certain directions. So these 3 systems work amazingly together, and they give us information to our brain, so our brain can respond with this information and provide our motor system or our muscles with information on how to respond or react. Now, our brains tell us different identification of how to react through 3 reactive strategies. The first one is called our ankle strategy. And our ankle strategy is for small forces, things that make us move just barely, right? Like leaning from left to right or front to back. And I kind of think of this as like the Michael Jackson, you know, when he's on stage and he moves a little bit through those, just the ankles and then backwards. That's how I think of this one. The second reactive balance strategy is called our hip strategy. And this one is a medium force. So it's a little bit bigger of force, and such as like a gust of strong wind. And that's when our bodies respond a little bit more so like a forceful movement through our hips or even our shoulders to keep your balance. The third one is the largest of forces, and our bodies respond by taking a step. So I always think of this as you're walking through a crowded Costco, right? And you bump into the person that's trying to get the same product as you, and they bump you so much that you lose your balance and you have to take a big step, right? So those are the three reactive strategies that we have based off of the information that we get from our three systems. Okay, so now let's apply this balance system and reactive strategies to falls, all right? For every 1 year, there will be 1 in 3 or 33% of community dwelling adults aged greater than 65 who will fall. Okay, that's according to the Journal of Geriatric, American Geriatric Society. The most common injuries associated with falls are head injuries, arm fractures, spinal fractures, and pelvic or hip fractures. And out of those hip fractures, approximately 25% of patients that have a hip fracture will make a full recovery. From that, 40% will require a nursing home stay. And then 50% will be dependent upon a cane or a walker. Now, I know this is kind of sad news, right? But the good news is, according to the Journal of American Geriatric Society, they say that falls can be reduced 13 to 40% in community dwelling adults through exercise and physical activity. Such great news, right? Moving is important in maintaining strength, flexibility, coordination, and balance. Don't stop moving. Ironically, literature suggests that an increased fear of falling is indicative of an increased risk of falling. So if you feel you're afraid of falling and this is holding you back from being able to complete important physical activities, I recommend calling your doctor and discussing seeing a physical therapist like myself. So some options for movement may be walking, some water aerobics, Tai Chi, which surprisingly has a lot of research behind it for balance and mobility, and then yoga, biking, hiking, things that you enjoy, really. So the ACSM and the CDC recommend that generally healthy individuals aged 18 to 65 complete moderate intensity exercise for a minimum of 30 minutes, 5 days a week, or vigorous exercise for a minimum of 20 minutes, 3 days per week. In addition, strengthening exercises should be completed 2 days per week. So that was for 18 to 65-year-olds. Above 65-year-olds, the Ministry of Health recommends that you aim to complete aerobic activities 5 days per week for at least 30 minutes if the activity is of moderate intensity, or for 15 minutes if it's a vigorous activity, or a mixture of moderate and vigorous intensity aerobic activity together. In addition to that, 3 sessions of flexibility and balance activities along with 2 sessions of strengthening activities per week. Unfortunately, aging is not preventable, but doing at least 30 minutes of moderate intensity aerobic activity on 5 days per week in sessions of at least 10 minutes at a time can greatly improve mobility and, as mentioned, reduce the risk of falling. So what's our action plan here? How can we prevent these falls from happening? According to the American Physical Therapy Association, we can prevent falls by the following. 1, keep up your mobility and improve strength. I'm going to say that a lot. Keep moving, okay? If you're just starting out with a physical activity regimen, then be sure to check with your doctor or physical therapist about what they recommend for you to start with. Okay, you can prep yourself for good mobility with a proper shoe that has good tread. Avoid high heels, slippery shoes, socks, or slip-ons. Secondly, you can get a fall screening. As mentioned, work with a primary care physician or physical therapist to identify your risk of falling. There are tests like the 5-time sit to stand, the Berg balance exam, functional gait assessment, and Tonetti balance exam. These fall screens are pretty speedy and can take less than 30 minutes. And the 5-time sit to stand can even take less than five minutes. So not only are these exams speedy, they have research behind them, enabling us as clinicians to identify risk of falling. Be sure to mention to your physical therapist or primary care physician if you're experiencing any dizziness, any loss of balance, or difficulty with your vision, okay? The third thing is mind your medications. Consider how many medications you're taking. If you're taking more than 4 medications, this includes over-the-counter medication and prescription, it increases your risk of falling, okay? So more than 4 medications, there's an increased risk of falling, okay? Dizziness, loss of balance, blurry vision, and other symptoms are common side effects of medication. So be sure to discuss these side effects with your pharmacist. It may be of interest to talk with your doctor about switching your medications in order to reduce the risk of falling. Fourth, you want to eliminate hazards around your home, okay? I recommend removing throw rugs, clutter, wobbly furniture or handrails, electrical cords, side tables, and lamps in high traffic areas. Anything that you could bump into or trip over. Be sure to clean up spills and repair loose boards, uneven ground, or torn carpet right away. Don't wait. Then, we also want to be sure that your frequently used items are within height that you're able to easily reach. So for cups in cupboards, you don't want them to be too high that you're having to grab a stepping stool for. Have them in a good location that you are easily getting to, things that you often get, right? Use non-slip mats in the bathroom, shower, and tubs, and utilize an easy-to-see color for steps or thresholds. Lastly, you want to improve your home safety. Install grab bars in the tub or shower and next to the toilet. Be sure you have adequate light inside and outside of your home. Avoid walking or moving around in the dark. Use night lights. Be sure to turn lights on in the evening before you leave your house, and make sure that your house is well lit for when you get home. Or even use lights that are on a timer that'll come on automatically when it starts to get dark. And then consider using rails for stairs, or consider putting rails in for stairs, whether the stairs are inside or outside. And then if possible, avoid steep stairs. Okay, other things to consider. We want to be sure you stay on top of your hearing and vision with regular visits to your doctor. Have a plan for weather. I know we're here in Reno, Nevada, and you never really know what's going to happen with the weather, right? So have an idea of how snow, ice, leaves, etc. will be out of your way, how they're going to be removed, or whatever you need. If you need to, use some rock salt for wintry days while navigating more slick walking surfaces. You can always fit some of that rock salt into a pocket or bag pretty easily, so you can just throw it if you need to. And then speaking of bags, try to use a bag that you're not holding in your hand, something like a backpack or an over-the-shoulder bag, so you can keep those hands free, okay? As always, eat a balanced diet, drink plenty of water, and try to limit the consumption of alcohol and or controlled substances, because I'm sure we all know that that can definitely impact our balance, right? So as far as a plan going forward, now, if you feel like you're having a hard time with your balance and notice yourself tripping or misstepping, it's a good idea to have a plan. These are kind of scary conversations, but they're important to have in order to do our best to avoid scary situations. So have a plan for what you would do if a fall were to occur. For example, are you able to get up and down off of the floor without an outside object, or do you need something to hold on to get yourself all the way up? If you're not able to get up off the floor without an outside object, then we need to identify a chair or a couch or something very sturdy, a counter that you're able to get to and have a place for that you can get yourself up with that object, right? And so that's what's called fall recovery. It's getting from the floor back into a standing position. And fall recovery is most definitely a task that you can work on with a physical therapist. The other thing you want to do is make sure you have a phone or an emergency device, a popular emergency device being like a life alert, something that you just push the button and EMS is identified or contacted and you've got someone on their way, right? Make sure you keep that phone or this emergency device on you at all times in case a fall occurs, especially if you're unable to complete that floor to stand fall recovery, okay? If that fall occurs, first and foremost, keep calm. Assess yourself and identify if you have any severe injuries. If you're able to, get yourself up. If you need to, crawl to that chair or that counter or what have you, what we discussed, and get yourself up with that outside object. If you're unable to get yourself up, that's when we need to call for help or call for 911. Okay? Our bodies are pretty incredible. The human body has the capability to improve, adjust, and adapt to challenges we place on it at any age. We just need to be sure we keep challenging it. So we can do that safely through continuing to move and working on strength, flexibility, endurance, balance, and coordination. Falls are a very real danger that can lead to a plethora of additional conditions or burdens. But there is a way to prevent these dangers from happening through movement. So keep moving. That's what I would like to say. All right, Kyle.
Sorry, I didn't mean to cut you off there. That was a great presentation. I really appreciate that. One thing I did forget to mention before we went over to Sedona is we are going to be doing a live Q&A right now. So if you have any questions whatsoever for Sedona, please enter them into our chat. We've already had a few questions come through, so I appreciate those who are watching right now. And we're going to get those answered in just a second. If you've liked today's presentation, though, make sure to like and subscribe to our channel, and that way you're going to be notified when we go live next week, tomorrow, and every other time that we're live here for Hello Health. Now, let me jump into those questions here. And actually, Sedona, I have a question of myself, because I was studying physical therapy before I went into the insurance world. What got you into physical therapy?
So it's kind of funny. I took one of those silly aptitude tests when I was in high school, and it gave me 3 options. And I ended up shadowing a few of my options and fell in love with physical therapy. And from high school on, that was my goal. And here I am, living my dream. So
that's awesome. No, I'm glad you love what you do on there.
Oh, yeah.
So one of the questions from one of our viewers, looks like Jose is asking here, what of the 3 systems is the most important? The ones that you had mentioned earlier in your presentation.
Yeah, I wouldn't say that there's one that's especially more important than another. The 3 systems work together to kind of form 100%. So one person may use more of a visual system in comparison to another person. So it really depends on the person.
Okay, so I mean, they're all equally important for us then.
Yeah, absolutely.
All right. Now, another question that we had coming through here, what does having more meds have to do with the increase of falling?
Yeah, so I'm sure we've all seen those commercials that have the plethora of side effects at the end, right? So as we increase how many medications that we're taking, we're also increasing the amount of side effects we're having. Or even one medication may have a side effect of loss of balance or decreased balance or dizziness, and then another medication may have the same thing. So as they add together, we get increased side effects, and we have therefore an increased risk of falling.
So you're saying those side effects are just stacking on top of each other, basically?
Yeah, 100%. Mm-hmm.
Okay, so less meds, better for us. Now, something that you mentioned that was pretty good for us was the water aerobics. We have a question on here. Can you repeat why water aerobics are so good for our balance when we're in water instead of on land?
Yeah, so water aerobics is a safer alternative, especially in the beginning of starting an activity regimen that's targeting balance. just because, you're in water. You're not going to have any falls there. But I would recommend that it be more of a starting point and that you progress to more of an on-land type of workout regimen, just because that's where we spend most of our time, if that makes sense.
No, that absolutely does on there. I mean, it's just amazing. We take, in younger ages, we take this just for granted as far as balance and fall prevention. Yeah. But, I mean, as we age, as you kind of went over those stats, those percentages increase throughout our years on there. Yeah. So a couple more questions on here. Are you going to be at the new hospital?
Still not sure. We're as Northern Nevada, we're still not really sure what is happening as far as the therapist moving around. But as of now, I'm staying with the South Clinic, the South Reno Clinic, for outpatient, and staying at our Northern Nevada Medical Center hospital here in Sparks.
Oh, good. Okay. And for those of you who don't know, Northern Nevada is opening up a new hospital down south of town. It's just off of Double R and Longley down there, and I believe that's going to be opening up next March. I want to say towards the end of March is what I was told, but I'm not too sure on the exact date on there. So, great. No, and Sedona, how can we schedule an appointment with you?
So, depending on your coverage, you can get a referral from your doctor. So go in and speak with your doctor about getting into physical therapy, and then just send that referral over to Northern Nevada Medical Center at the South Reno Clinic off of Steamboat.
Perfect. So, and also if you guys need any of these answers that she's been saying, they are going to be in the comment section below. We do have moderators here typing, how to schedule an appointment and giving you some of those answers for you. Jose just asked, can you do a presentation on just water aerobics?
I would be happy to. I don't think
No, and also I do want to ask, does this information only apply to elder adults, or is this, just for everybody?
I think it applies to everybody. I think it becomes more important as we age. There's definitely that stigma out there that, we're told as we age we need to stop moving, or that we're too old to do something like that. And that's kind of something that I'm always like, no, we should work towards, if we find a task that's hard, we should work on getting ourselves to the ability of completing that task. So it applies for everyone. Keep moving.
Yeah, no, I think that's some of the best advice here. I mean, just continue to move. I was always told that. I worked in a PT clinic in college, and that's what the physical therapist had always said. Just keep moving, and it's the best thing for you. But that is exactly what they always said to me. That exact line right there. So maybe we. Yeah. Okay. Maybe we know the same physical therapist then. So, and on here, let's see here. I have Katie on here asking, is Renown building a new hospital? I'm not too sure, and I don't know if Sedona would know that, but just because she does work at Northern Nevada, but I do know that new hospital for Northern Nevada is opening next year.
Yeah.
So. But I do appreciate all the questions. It looks like that's all the time we have for today on those questions. If there's anything that I missed out there, I will make sure to go through that comment section and get those over to Sedona to get them answered, and I'll be sure to answer those online. So Sedona, I really appreciate you coming on today. Thanks for talking about balance and fall prevention.
Thanks for having me. Appreciate it.
Well, everybody, thanks for tuning in today. I really appreciate everyone's questions that you had for her. And like I said, if you have any more questions, feel free to get those out there, and we'll make sure to get those answered. But be sure to tune in. We have another episode of Hello Health coming tomorrow. Alex is going to be sitting down with Jordan Pena from Renown, going over personal assistance through their Medicare. So if you have any questions then, make sure to tune in tomorrow at 10:30 a.m. Also, if you enjoyed today's show, make sure to like and subscribe to our channel. Ring that bell for the notification. Once again, I'm Kyle DeVries with Health Benefits Associates. Thanks for watching.